Welcome to the Get the Lead Out of Drinking Water program, developed by the New Hampshire Department of Environmental Services.
All right, I think we'll go ahead and get started. We still have some folks joining the meeting and we'll let them in. But welcome everyone to the Get the Lead Out of Drinking webinar. We're very happy that you took the time to join us today, and hopefully we'll provide you with some good information about the lead in drinking water testing that's required at schools and childcare facilities in New Hampshire. Just a few logistics as we get started. You'll notice that the meeting is being recorded, and we hope to make this available at a later date so you can go back and view it again, and we can also share it with folks who weren't able to attend today. We have everybody in the meeting set with their cameras and microphones off, but if you are needing to get in touch with someone or want to ask a question, the chat box is available, so please type that in the chat. The format today will include a panel presentation, and some of you submitted questions when you registered. Thank you for doing that. But if you have other questions that come up during the webinar that you want to have answered, please be sure to type those in the chat and we'll get to as many of them as we can. And hopefully we'll get through everything, but if not, we can answer the rest offline. So we're going to keep things at an hour today. And we'll just start out by going over what's on the agenda for today. So if we can have the next slide, great. So we'll start off with an introduction to the Get the Lead Out of Drinking Water program. And then I'll turn things over to Victoria, who is going to give us an overview of the key legislative changes that went into effect this summer and talk about the Get the Lead Out of Drinking Water program. And then most of the webinar today will be a panel discussion with a Q&A, and we have representatives from Department of Environmental Services, Department of Health and Human Services, Department of Education, as well as schools and childcare facilities that are available to help answer questions and share their experiences with testing for lead in drinking water. So let's start out by talking about what is Get the Lead Out of Drinking Water. I've had some people ask me, is this a legit program? I've gotten a phone call or an email from the Get the Lead Out of Drinking Water program. What is this program? So many of you probably have gotten phone calls and emails from the program. And the program was started to provide support and technical resources for schools and childcare facilities doing lead and drinking water testing. This was started by Department of Environmental Services, and we are working closely with New Hampshire Departments of Education and Health and Human Services to support the program. We're also trying to provide general lead education to residents across New Hampshire. And we'll get into this more during the presentation, but there are free sampling and laboratory analyses that are available to public schools and licensed childcare facilities in New Hampshire. There's also technical resources that are available to all schools and childcare facilities. And really the point of the program is to reduce children's exposure to lead through their drinking water at schools and childcare facilities. And so really is so important that we're all doing this testing. And so thank you for taking the time to participate. And so with that, I will turn things over to Victoria, who will talk more about the program.
Hi, thanks, Leanne. Thank you for having me here, everybody. I'm super excited to be here. So let's just get started with some background. So because lead is tasteless, odorless, and colorless in drinking water, testing is really the only way to know if lead is present. So House Bill 1421 was signed last month, July 2022. It is an amendment expanding on the updates from Senate Bill 247 from February 2018. Now, both of these are underneath the overarching state law called RSA 485, requiring schools and licensed childcare facilities test each drinking water outlet that could be used for consumption by children. We want to sample that for lead. So today I'm going to review some of the key changes that was made to this legislation, what a facility's responsibilities are under this updated law, and give a little bit more on the Get the Lead Out of Drinking Water program before handing it over to the panelists. So this is a high-level overview of the 4 changes we're going to review today, and we will go into more detail for each of these on the following slides. First, facilities are now required to do 3 rounds of sampling between that initial 2016 start date and June 30th, 2024. And just as a reminder, facilities should sample all outlets that children could be consuming from. So these are drinking fountains, classroom sinks, kitchen faucets, bathroom sinks that are used for teeth brushing, etc. Also remember that these rounds of sampling are required whether a facility is on well or town city water. This testing requirement is in addition to other testing requirements that a PWS may be completing. These points haven't changed, but they're just important to mention. The second change is that the allowable lead concentration has decreased from 15 parts per billion to 5 parts per billion. What that means is that a facility will now have to remediate any outlet that tests at 5 parts per billion or higher. The third change is that sample results must be submitted to NHDES. And the fourth change is that remediation must be submitted to NHDES for sample results at or above that 5 part per billion mark. So the first major change is the rounds of sampling. So facilities should complete 3 rounds of sampling by the time we've gotten to June 30th, 2024. There should be at least 6 months between each round. And most facilities are on or ready for round 2 because the sampling that you've done since 2016 does count as round 1 sampling. Moving on to the second change, we have the lowering of the allowable lead concentration. So with changes from HB 1421, any drinking water outlet that tests at 5 parts per billion or higher in the future or from previous rounds of sampling must be remediated and reported to NHDES. So there are 2 big takeaways here. The first one is that the lead concentration has dropped from 15 parts per billion, which is how lead is measured, to 5 parts per billion. Number 2, this change does pertain to previous rounds of sampling. So this means as a facility, you should go back and take a look at your previous lead sample results and see if there are any outlets that tested at 5 parts per billion or higher that now need to be remediated and reported to NHDES. There is no safe level of lead in drinking water. The last couple of key changes we're going to review are about reporting sample results and remediation actions to NHDES. Facilities that have never done any sampling for lead in drinking water are required to initiate sampling by August 8th, which I know has already passed, but enrolling in the program will still initiate that sampling for your facility. Facilities with past sample results at or above 5 parts per billion have until October 8th, 2022 to report remediation actions to NHDES. For future rounds of sampling with this program, it is still a facility's responsibility to review results and report remediation actions to NHDES through the remediation reporting form, which you can see a short snippet here on the right. A lot of you might actually recognize this already as you have been turning in remediation information. So now that we have reviewed some of the key legislative changes, let's take a look at enrolling in the free Get the Lead Out of Drinking Water program. You can enroll in the program to receive technical and financial assistance if eligible. It only takes a couple of minutes. You can follow this QR code or go to gettheleadoutnh.org. Scroll down to the big blue bar that says Resources for Schools and Childcare Facilities. Find the enrollment link on the right. And after enrolling, you will complete an outlet inventory. So this is going to be when you identify the number of drinking water outlets that should be sampled at your facility. We also offer training videos and materials at gettheleadoutnh.org. Really, anybody can sample, and if you have any questions, you are always welcome to email or call the helpline, and you do have to enroll to get that sample kit. So let's take a look at some of the program features. For every participant, we do offer technical support and other benefits like a helpline to answer questions, communication templates for parents and community members, sample instructions, how-to videos, educational resources, and general information about lead in drinking water. We do have free lead analysis from the EPA WIN grant for public schools and licensed childcare programs. And we have other funding mechanisms as well, like a 50% lead remediation grant for public and non-public schools that is available until the end of the year. And facilities can apply for this separately or as an SAU. So as we discussed before, facilities do need to go back and remediate any outlets that tested at 5 parts per billion or higher. So there are several options to properly remediate a drinking water source. Here are some examples of remediation from less to a little bit more complex. The first is hanging signage. If an outlet doesn't need to be used for drinking, you can post signs saying do not drink or use for food prep or hand wash only. The second example that you see here was a facility that fit a under sink filter. The third is of plumbing corrections. And the fourth is an example of a facility that installed a filtered water bottle filling station with a filtered bubbler attached. We also have a remediation guide coming soon that will hopefully help you choose which actions might be best for your facility. And with that, I am going to put up my program contact information slide. So this is just going to be the helpline hours and the phone number. And then at the top, you'll see our info at gettheleadoutnh.org. That is our email inbox for if you have any questions. And I am going to hand it over to our moderator, Shannon, for some good panel Q&A discussions.
Thank you, Victoria. My name's Shannon. I'm going to be moderating the Q&A. So we can go ahead and get started while you all still have this program contact information and kind of dive in a little bit more to some of what Victoria covered. So we do have several panelists, as Leanne mentioned, from different organizations on the call today that will be able to provide their expertise and experience too. So I'm going to start with 2 general program questions. We did receive some questions ahead of time when folks registered, so thank you all for submitting those. The first general program question was, could we review the requirements for lead testing? How often? What are the acceptable results? What requires remediation and what is that process? And I know that Victoria did cover some of those items in her presentation, but if any of our panelists kind of want to jump in and give a quick recap to those questions, I think that would definitely be helpful.
Hey Shannon, I can answer this question. My name is Sam. I'm the data manager with the Get the Lead Out of Drinking Water program. So I'm working a lot with the data that we're collecting from all of the schools and child care facilities in the state. And so I think the first question was, how often is testing required? Per the new law that was passed in July, there needs to be 3 rounds of testing that is completed by a school or a child care facility. Those rounds have to be completed by June 2024, and there has to be at least 6 months in between rounds of sampling. Something else to consider is that a round of sampling means you test every single drinking water outlet at your facility, regardless of whether it's been tested before. That kind of gets into kind of the nature of lead, and lead can be very transient, so you don't be surprised if you see very different results between the rounds of testing. In terms of the results that you received back, as Victoria had mentioned, the acceptable level for lead has been lowered from 15 parts per billion to 5 parts per billion. And so what that means is if you get your results back and you see that there are any outlets that test at or above 5 parts per billion, you are required to remediate that outlet and then report that remediation to us. And we have, methods of reporting that remediation, and all of that is available to you and will be communicated to you as well. I think that covers all the questions, Shannon.
Yeah, I think so. Did any of our other panelists? Yeah, Leanne, go ahead.
Sorry, jumping right in. I'm kind of saw that there was a question in the chat that was kind of related to that. If folks have already done a round of sampling and their results came back low or non-detect, they still have to sample all of the outlets for a total of 3 rounds. So the law requires 3 rounds of sampling, and then if those 3 rounds you have detections at or less than 5 parts per billion, then you don't need to do any more testing. So even things that were non-detect previously should be tested again.
Yeah, definitely. That's helpful. Another general program question that we got was, what was the reason for lowering the action level from 15 to 5 parts per billion?
So I'll take a stab at that one. That was something that came up through the legislature, that proposed change, and it really is to reduce the allowable level, because we know there's no safe level of lead in drinking water. EPA has set their maximum contaminant level goal for lead at 0, and so this is an effort to reduce lead in drinking water, particularly for vulnerable populations. Children are more susceptible to the dangers of exposure to lead.
All right, great. So the next kind of category of questions that we have are related to sampling rounds, and I do see some questions popping up in the chat right now that relate to sampling rounds as well. So I think we can dive into some sampling round questions and then get those questions that are in the chat. So one of the questions that we had several times was, if I've tested back in 2018 or 2019, does that count as my first round?
I can answer that. Yes, if you tested all of your drinking water outlets, that does count as your first round. The only thing that you need to consider is that with this lowering of the action level to 5 parts per billion, you're responsible for going back to look at those previous rounds of sampling and make sure that any outlet that tested at 5 parts per billion or above is remediated. So even if back then you didn't have to remediate it because it was below 15 parts per billion, you're required to remediate it now.
Great, thanks, Sam. So I think, for most folks here, most people are probably on that round 2 of sampling, because that round 1 from 2018 and 2019 does count. So round 2 and round 3 would be the 2 rounds of sampling that folks have left to do. Looking here in the chat,
Shannon, can I just add? Sorry, just interrupt you and just add that the sampling. Any sampling from January 1st, 2016 on would count. So there were a number of school districts in the state and childcare facilities that went ahead and sampled in 2016 prior to the law being passed in 2018. So those data from 2016 also count as a round of sampling too. So thanks.
Great. So Leslie asked, we have had at least 1 round of lead testing, but we were on well water. We have since converted to public water. Does that set our samples due back to 3? And I think what that means is, are we now back to round 1, even though we had already done the first round of sampling when we were on well water?
So no, that first round of sampling would also count towards the total.
Okay, great.
One thing to add, Shannon, actually, I have one thing to add to that. I'm not sure if this is a situation where the childcare facility has moved locations or not, like if they just happen to be converted from well water to town water at the same location, then that first round of sampling would count. But if it had moved locations, then okay, same. I see that the chat says same location. So I'll just, for anybody else that's wondering though, if you had moved locations, the location that you moved to is required to have 3 rounds of sampling.
And I think that might answer the next question, but I'll go ahead and dive in case that has a little bit of a different answer. We have new buildings coming online in the next few years. We would be required to do the 3 rounds of testing beginning when the buildings open.
Yes.
Okay. Oh, question from Matt. Where do I find the account number in the application? We have 8 locations and I need to get the building or account number. So I think that what Matt is asking about there is the enrollment form. So if someone from our panel wants to provide more clarity on, using that enrollment form.
I can answer that question too. So the enrollment form is emailed, and you need to fill out an enrollment form for each facility that you're enrolling in the program. The way that we're structuring the enrollments is that you enroll using your licensing ID. And so that is a ID that's assigned to you by the state. If you can't find this, it's in the email that we send out when we're asking people to enroll. But you can also just reach out directly to us, especially if there's 8 facilities that you need to enroll, and we can help you with that.
And I just put in the
Okay.
chat, we do have a website available where you can look that information up too. So I typed that in the chat so folks can have that.
Perfect. Thanks, Leanne. So some questions around funding. Is the state going to be able to provide financial funding for the program as long as it is required?
So DES has received funding from EPA to cover testing at schools, at public schools and licensed childcare facilities. And our intention is that we will be able to cover the next 2 rounds of sampling that are currently required. That being said, it is, a finite amount of money, and so we would encourage folks to participate in the program and go ahead and sign up if you're eligible to take advantage of that funding to make sure that your costs will be covered.
And I think this is a good place for me to jump in. I'm the leader of the Choose Safe Places program for early care and education, which pertains to childcare facilities. And we are in the process of a private well water testing initiative, which provides free water testing for childcares that are eligible, which means that they have a well and they serve fewer than 25 people. So many of you, if there are some of you on this call that fall into that category, you may have heard from us, but we have worked closely with the Get the Lead Out of Drinking Water program such that the testing that we do as part of our Choose Safe Places program, which includes a larger number of contaminants, it's not just lead, but it does include the stagnant lead. So if you participate in our free water testing, which covers other contaminants required by childcare licensing rules, then that does count as a round of testing for you, and it is free through our program.
Yep. Great. Thank you for that, Lori. I think I did miss a question here in the chat about how will this impact a program that opens, say, in 2023? Will this be a requirement for all newly open programs going forward?
So Carrie, do you want to speak to that from the school side of things?
Sure. So I know if there's a new school opening, we will be asking for your lead data to be submitted or to at least know that you have tested or are in the process of testing. So any new schools will be asked that information. And there's also the school approval process that happens every 5 years. So you'll also, during those visits, you'll be asked if you have submitted your data.
Okay, great. We have some questions about where to sample, and we got these ahead of time, and I see some popping up in the chat too. So we have some questions here specifically around sampling things like custodian closets and science lab sinks. bathroom sinks, what faucets are considered drinking water, and how should facilities go about deciding that when they're completing their outlet inventory?
I can take that one. So under the state law, all outlets that are used for drinking water must be tested. But I guess in reality, that can be hard to, distinguish. What we tell people is that if it could feasibly be used for drinking or in bathroom sink cases for teeth brushing, then we'll go ahead and test it. A custodial sink is not typically used for drinking water. So unless you have, firsthand account of someone says, oh yeah, I use that to fill up my water bottle, then I would go ahead and not test that. So really it comes down to when you're filling out your outlet inventory and you're going around to all of the different outlets, making sure if you can talk to people and say, hey, if there's a teacher in a classroom, do you use this outlet for drinking or is this just for hand washing? So it's kind of, dependent on the facility and the circumstances, but we try to, err on the side of caution. And if you're not sure, then just go ahead and test it.
Yeah, great. Thank you. I think a second part to that question that we had was around filtered water bottle fill stations. So someone asked, we have filtered water fountains in every school, and we tested every faucet that a student could get a glass of water from in the last round of testing in 2019. Leanne, I'll throw this one to you because I know there's some language within that new state law specifically around, filtered water fountains. Do those still need to be tested? And, can you elaborate a little bit more on what the law says about those?
Yes, so the filtered water bottle filling stations should still be tested. Ideally, they would have been tested after they were installed to make sure they were working properly. And those stations are great, but you do have to keep up on maintaining and changing out the filters. So that's really important to keep in mind, that you have to stay on top of, what the manufacturer requires for replacing those. So yes, those should be tested to make sure that they're still functioning properly.
Okay, great. And I think that, we may have kind of gotten to a clear answer on this, but do you have to test all the same sites as you tested in the first round, or can those sample locations change round to round?
You do have to sample the same outlets between each round, but they shouldn't change because you should be sampling all outlets at each round. So I think the only time it would change is if after a round you complete some remediation that you find a classroom sink is really high in lead and you decide to just take that, remove it completely from service. So obviously you wouldn't be able to test it the next round. But in general, yes, all of the outlets should be the same between rounds of sampling.
I think this would be a great opportunity to Sam or one of our other panelists, if you all, want to elaborate a little bit on, how we're going to be able to connect the round 2 and round 3 outlets to make the process easier for facilities, and kind of more succinct between the sampling rounds.
Yeah, I can talk about that. So the first round of sampling, when the data was submitted to NHDES, we didn't have great information on the outlet locations. So we're not really able to take that information and send you a list of your outlets that you tested. It could be back in 2016. So that's the way around that. That is this round of sampling. We're having everybody fill out an outlet inventory where you're going through your facility and recording all of the outlets that you need to test, and all of that data is being uploaded to our system, and you're doing it on a smartphone or a computer or something, so it's like through the cloud or whatever is being uploaded to our system. And so for round 3, we will have a list of your unique outlets because we would have much better data for this second round of sampling. So ideally, for the third round of sampling, we'll be able to provide you a list of your outlets, and we can keep those consistent across round 2 and round 3. If that doesn't make any sense, I can answer some more questions about that.
Okay, great. I think that might be sparking a few other questions here in the chat. So, you know, it looks like we had a facility that maybe only tested one bathroom sink, that all of their bathroom sinks have the same faucets in round one. So is this changing because it would add hundreds of additional locations for that facility?
Yeah, so lead is very transient in nature, and what we're sampling for is fixture level lead, which can change drastically between outlets of the same type and in the same building. So that's why we're having everybody collect samples from every single outlet in a building. When it comes to bathroom faucets, though, I would say that if you don't know that they're directly used for drinking water or teeth brushing, then that wouldn't be a faucet that needs to be sampled.
I see Rob has a question here about what if we oversampled on round one, continue sampling the same outlets? I think, you know, I don't want to speak for Rob, but an example that I can think of there would be, you know, a situation where a school tested those science classroom sinks and the custodian sinks round one. I know, Sam, that you mentioned, you know, trying to keep sampling the same things between rounds, but I think we have established, right, that those do not need to be sampled. So just wanted to provide some clarity there.
Correct. Yeah. So if a school or childcare facility sampled outlets that aren't really feasibly used for drinking water or cooking, then there's no need to retest those for round two.
Okay, Brian asked, we added water bubblers. Do we need to do 3 rounds of testing separately as the others have already been tested once? Leanne, do you have any thoughts on that one?
Sure. So I'd say as long as the bubblers have been sampled, that were, you know, if they were added in response to taking other outlets offline, you know, those should be tested. Sorry, I'm making sure I understand the question, and then do the other. Yeah. So those would need to be tested, and then if there are other outlets that are still available for kids for consumption, then those would need to be tested 3 times. But if it's a water bubbler that was installed, I know you have to at least sample it after it was installed, and then I'm not sure about how many times after that you would have to sample, so I can get back to you on that, because I know the new law does have some language specifically related to bubblers in there.
Okay, great. I saw Sue, who is actually one of our panelists as well that we haven't heard from yet, but she asked a question, are any grants going to become available for licensed childcare facilities for remediation costs?
I can answer that somewhat, and others can chime in. We, through our Choose Safe Places well water testing initiative, have been working with the Bureau of Child Development and Head Start collaboration to make sure that the testing that happens through that program, which does include lead and does count for 1 round of this lead testing, would also have funds to pay for remediation should it be necessary. And our understanding is that would include lead remediation. And just again, a reminder from those slides earlier, lead remediation can mean a variety of things, from putting up the sign to more technical changes. And it's not about the water, it's about the plumbing. So through the Head Start ARPA funds, which some of the child cares have potentially applied for, I believe there have been funds sent out, and if they haven't already been sent, they will be sent. And some of that is to be earmarked for well water remediation. And so that's for child cares who have wells. For other programs who are considered public water systems, I can't speak to that, nor can I speak to schools, but that's what I know.
Thanks, Lori. And I'll chime in that So far, the funding that we've received from EPA has only been able to be used for testing, but with the bipartisan infrastructure law that was passed last year, there's been some changes to that grant program, and we understand that New Hampshire is set to receive another allotment of funding, and that we will be able to use that funding for remediation, which is fantastic. And so we're still waiting to hear back from EPA about the requirements for that funding and what that will look like. But our intention is that we would use that funding for remediation at childcare facilities.
Great, thank you, Leanne. I do have one question here related to, some of the resources that the program provides around communications. What is the best way to alert families, and what are the requirements around communications with the new law?
That's a great question, because the new law did make some changes to the requirements. So if you have an exceedance or a detection at or above 5 parts per billion of lead, there's a requirement that you have 5 business days to notify parents and guardians of the exceedance. And the requirement is that the notification has to be made in at least 2 places, one of which is a posting on the website of the school, the SAU, the child care program, but on the website, and then a direct communication. And that could be an email, a flyer that's handed out to parents and guardians. And we have template letters available on our website that you can use. If you do your testing and find that you do have an exceedance of that 5 parts per billion standard, you can use that template and use that to notify parents and guardians to meet that notification requirement. And I'll also say that, we think it's important to share all of the data with your parents and guardians. Even if it's non-detect, that's great news. It's important to let folks know that you're doing this testing and what you're finding. And so we would encourage you to share all of the data. And to make that easier, we have a new feature set up on our website where we have a view into our database. It's organized by county, and you can go in and find your facility and see all the data that have been provided to DES. And so that's a great resource. You can use that link to send to parents and guardians as a way to notify them, or just share the data if you don't have any exceedances, but just to let people know about the testing. And I don't know if anyone has anything else to add on that, but I just wanted to clarify that I did put some language in the chat about the bottle filling station testing requirements. So my apologies about that, but there are some specific requirements in the new law for bottle filling stations and the testing that that you need to do related to those.
Great, thanks, Leanne. If anyone else has any questions, keep sending them in the chat. I think that we have addressed most of them. So what I thought, might be great to do for some of the remaining time that we have available is, I know we have some folks on our panel that, either are a childcare provider or, have completed the sampling for a school. And so I would love to, hear from anyone on our panel from a school or childcare facility. If you have anything to add, if you have any, anything that you learned as you've done sampling, or anything that we haven't touched on during the webinar today that you think would be helpful for other childcare providers and, school personnel that are on the webinar today with us.
Hi, this is Sue. I'm a family childcare provider. I just wanted to make it known that the last round of testing was really difficult on us as providers. I personally had to drive to Concord to get the bottles for the thing, and then I had to, when they were full, I had to bring them back to the lab for analysis. This round was so much easier. They were mailed to me within a day or two, and they went out the same day, FedEx, when they were and they picked it up at my home when the bottles were full. So already actually been received in the Maryland office where it needs to be tested from yesterday.
Yeah, great. Thank you for sharing that, Sue. You know, we're definitely trying to work to make the process a little bit easier. So I'm glad that that is working out and you had a good experience. I think Brian has his hand up. Brian, we'd love to hear from you.
Yeah. Hi. I just wanted to add, I'm up in Berlin, New Hampshire, a school facility up here, SAU 3, and we're a dependent school district of the city, so we're a department of the city. And when we did our first round of testing, I call the waterworks. I mean, we have a good relationship with the local, which is also a department of the city, and because they're familiar with sampling, they do it all the time. They worked with us. They took all the samples. They sent them down to the state lab. They got them all back. I don't even really think it cost us anything to have it done. Very little, if anything at all. And it worked really good. So I don't know the smaller towns, the smaller communities, if they have a water precinct, that's a good resource, at least from my experience, to reach out to the water precinct to have them help with the sampling.
That's a good suggestion, and I know that that Manchester Waterworks did something similar for schools and childcare programs in the city of Manchester. They actually did some of the sampling for them, and then in other cases helped coordinate the sample containers and getting all the paperwork filled out.
Great, thank you both. We have a comment here. We need to take a picture and ID number for each place of testing. Do we do this, or do we have an outside company do this? So I think that this kind of, ties into, what Brian just mentioned. For some larger schools, perhaps this is something that your water system could help you with, but everything has been designed in a way that it's all do it yourself. With the proper training, anyone can collect samples. There's no need to have to, hire someone to come in and help you complete that outlet inventory. Those instructions are, hopefully straightforward. And if you have any questions when you're going through that outlet ID, definitely call our helpline and we can help you with that. The average number of locations to sample for childcare facilities is a lot smaller of a number than it is for schools. Schools could have hundreds of samples, so completing this form might take longer and might need, some more assistance from, other school administrators or some of the maintenance or facilities personnel. But yes, everybody can do it themselves. This program is designed to be very DIY. Identify the locations that you need to collect samples, and then review the sample collection instructions when you receive your materials from the lab to make sure that they're collected properly.
But I would add to that if you are more comfortable, you have a company that you've worked with in the past that's done sampling for you, yes, they can absolutely do this for you. We do ask that they still go through the process, or you go through the process of enrolling in the program. So that'll set off the workflow to be able to do that outlet inventory. But you could also have, if you have a sampler that has done sampling in the past, you could have them enroll for you and do the outlet inventory and do the sampling. So that's definitely an option. But we do ask that they still follow the same process so we can have consistent data on the other end.
And
yeah, that's a really good point. I was thinking of it from the perspective of, oh, I don't want you to have to, bring someone in and pay extra for this. But, if you have this established already from round one, that can be a great resource and you can still enroll in the program, as Leanne said.
Yeah, I'm going to add a clarification to that, though. If you're a childcare facility or a public school, if you want to take advantage of the funding that's available for sample analysis, then the sample analysis has to happen through the state assigned lab. So if you were going to, have a contractor come in and do the program for you, they would still have to be sending the kits to our lab so that we can cover that. So the samples can't be sent to, the contractor's lab that they use. It would have to all kind of still fit within the program workflow. And
I just want to add a clarification about the program. We really would like for everybody to enroll and do their outlet inventory. If you're a public school or licensed childcare facility, then that'll put you in the pipeline to get your sample bottles ordered from the lab. If you're a private school, you can still enroll, do the outlet inventory, use that tool, and then we'll send you information that about labs that you can contact, and then send you information that you can use to contact the lab. And you'll still be able to have the information about how to name your samples and how many sample bottles you need to order.
Great. Yep. Thank you, Leanne. Richard said we had to have PECs run and it cost a fair amount. Is there a way to get a refund through this program?
I can talk to that, I think, a little bit. It depends, Richard. I'm not sure if you're coming from a school or a child care facility. There is a remediation grant that's available to both public and non-public schools. It's not through the Get the Lead Out of Drinking Water program, but we have resources online, and I'm sure someone in the chat can post that page for how to kind of apply for those funding.
Carrie, I don't know if you want to speak to that, but it is the funding is a 50% remediation grant that's available to schools.
Yep, and that's for public and non-public schools.
And so it would cover costs if related to addressing an exceedance of anything at 5 parts per billion or higher for lead. And that includes parts, labor, any costs associated with retesting.
Yep, so that link for the lead remediation grant for public and non-public schools is in the chat. So if that's helpful, to anyone, definitely encourage you to apply. And if you have questions about the application, you can reach out to our helpline as well. I think we've got about 10 minutes here. So any other thoughts? Leanne, did you have something to add to that last one?
Yeah, just to follow up on the grant. So currently it's set to expire by the end of this calendar year. And so if you're interested in applying, if you're thinking you have something, reach out and let us know if there's a need. And, we get a lot of applicants, then, there's the potential to extend that deadline. But even if you don't have your project completed, if you just have cost estimates together for how much you think it's going to cost to do the work, you can still apply with that information. So if you're interested, please reach out.
Great. Gabby asked, is there somewhere we can look up our previous testing results? So I have added a link to the chat where that data is posted on the DES webpage about the program. That's listed by county, and you can choose either school or child care facility. And so that resource is there as well. Any other questions or any other comments from our panelists about previous testing results and being able to access those?
I guess just the one comment, which might be very straightforward, but in the link that Shannon sent, you can filter by your facility name. So it's a link to all of the results that we have for that child care facilities in that county. But they're up at the top. There are options to sort the data and filter, and you can also just search the data and export as a Excel or CSV.
And we encourage everybody to go on there. Again, I think we said this before, but check it out and make sure that your data are up there. We tried to be as thorough as possible, but we are finding that we're still missing some data. So check it out and let us know if something doesn't look right for your facility. And I also want to add that we are also working with University of New Hampshire and their GIS center to create an interactive map-based website that'll host this data as well. So that should be coming out by the end of this year.
Great. Yep. The other thing on that data online, there is remediation information. So once you've reported your remediation, that will show up next to a data point. So I know this can be helpful for, some facilities where, if parents or the community asks, what has happened at this location to correct test result, that's another resource where you can, share this website with your community too and say, hey, all of our remediation and the actions that we took are listed here as well. So it's a good centralized data point. We have a question about what does BRL mean on the data? Good question.
I can answer that. BRL means below reporting limit. And so essentially that means that lead was not able to be detected above the reporting limit for the lab.
Awesome, thanks. I think, Sue, do you have your hand up? Is there anything that you have?
Yes, I do. I happened to be speaking with Leanne yesterday directly in regards to the information on your database, and I was only showing one of my outlets reported, and I had uploaded 4 prior to that. So I just wanted to make it people aware that they maybe they should check to make sure that all of their information is currently on there. All I needed to do was send an email with the other outlet posts so that it could be posted today.
Yeah, that's a great point. If you look at the results and find that, hey, I did way more testing than is on here, it probably just means that either the lab you used didn't upload it to DES or it was assigned to a different facility. So just shoot us an email at the program email address and we can get that sorted. Especially if you have the lab report. If you just send that to us, then that makes it really easy.
Great. All right. Any other final thoughts from our panelists or any final questions?
I'll just say that great to have everyone here, and please spread the word. Promote this webinar, as was mentioned, will be posted and it's been recorded. So if you know folks who might benefit from it, who are in your field, please pass it on. Please, post this through your community and your networks and talk to folks to say, we did this, it's required, it's easy. We hope you feel it's easy because in the end, it's going to be reducing exposure for children to lead, which is, as was mentioned earlier, we don't want any lead in the water or anywhere. So thank you.
I just wanted to say I found the entire team that I've had to work with 2 buildings and the lead that we've had, I found you extremely cooperative and easy to work with. So I appreciate it.
Great. Well, thank you, everybody. Thank you to our panelists for your time today. And thank you to everyone that took the time out of their day to join this webinar. And I think Victoria has sent our contact information in the chat as well. So if you have any other questions, feel free to, send us an email or, we're happy to talk on the phone as well. And we can also accept text messages. So that information is there for everybody. All right, great. Well, have a great afternoon.